Registered nurses have a professional responsibility to practice safely and effectively within his or her scope of practice. This is from the ABA, the year 2000. Each nurse and midwife is expected to develop and maintain competency with regards of all aspects of medication management, ensuring that his or her knowledge, skill and clinical practice is up to date. And again, this is ABA 2007. The fundamental concepts of accountability, autonomy, competence and delegation that are considered in determining the scope of practice also relates to the professional role in the medication management, and that's from ABA 2007. When a practitioner works for an employee within the policies, procedures and guidelines laid down by the employer, the practitioner will be covered by the trust via vicarious liability. Should the employer act outside the guidelines or the protocols, that they are liable themselves. Prompt consistency between healthcare professionals as to what constitute medication errors will contribute to an increased accuracy and compliance in responding to medication error, therefore informing the healthcare policies aimed at reducing the occurrence of medication error. The contributing factor to nursing medication error are manifold and includes both individual and systems issues. This includes the types of drug distribution systems, the quality of the prescription, the deviation from the procedures, including distractions during administration, excessive workload, and the nurse's knowledge of medication. Mathematical competencies for nurses in practice is an important issue in the prevention of medication errors. Medication error falls into two main areas. One is a failure to adhere to the accepted standard of practice in relation to medication management. A failure on part of the nurse or midwife to accept that she or he has a problem with medication. The nurse or nurse drug calculation skills have become a national concern, and this is Department of Health 2004. It is not solely a mechanism task to be performed in strict compliance with the written prescription of the medical practitioner. It requires thought and exercise of professional judgment, and that comes from the National Nursing Council in England in 2004. Medication error affects 3 to 5% of hospitalized patients. Patients may suffer prolonged hospitalization, disabilities, or even death. How many unreported incidents are recorded? It is estimated up to 70% are unreported drug errors. The ultimate consequences for the nurse can result in fitness to practice hearing. The healthcare industry can benefit from learning from high-risk industries, such as the aviation, in prevention and management of system errors. Calculation difficulties continue to exist and have not improved, and that's dating back from O'Shea 1999. An article on the 28th of March published the data compiled by the State Claims Agency over a 60-year period. This indicated that healthcare workers are involved up to 8,000 medication error or near misses per year in Irish hospitals, in which 7,000 are due truly to incorrect drug dosage. Just explaining, a near miss is a medication error that is detected or corrected through intervention before the error occurs. And this is from the American Pharmacy Association in 2006. It is essential that near misses are reported and are documented. So when researching my thesis on medication management for the MBS in health and safety at work, it became evident that medication error is an international problem. For example, in England, there were up to 70,000 medication errors reported in 1 year. That's from June 2009 to 2010, according to the NHS. It is not clear what percentage of error remained unreported. Medication administration is perhaps the highest risk activity that a nurse can perform, as accidents can lead to devastating consequences for the patient and for the nurse's career. Drug dosage It is an initiative to assist in the avoidance of drug error. It is not intended to be used as a primary source for drug calculations. In the calculations, what you can do using the app is you can do volume of liquids, you can do IV drop rate, you can do number of tablets, IV volume rate, fluid balance, the dosage for the body weight as well. And these can be all used as a double checking for drug calculations. So what is an application? Mobile applications are software programs for smartphones and are often handheld computer devices. Apps let you perform functions similar to those you use on a desktop or laptop computer, such as looking up drug information. In the healthcare, the most common mobile app downloads are clinical reference, also known as the POC, which is point of care. References such as electronic drug manuals, drug calculations tools to facilitate and to analyze of the lab and diagnostic studies and different diagnostic guides. These references are made access through current information, which is much easier for the nurse at the point of care. Working through the areas that are difficult, never being intimidated to say, hold on, I need to check again. These are the voices from nurses who find it difficult to actually admit that they are having problems with drug calculations. One has to be honest and to seek advice and to get behind the fear to create a positive feeling. Using the app to help you get more proficient in testing yourself and in the double checking mechanisms will make you more confident and a safer practitioner. Many nurses are anxious when they come to drug calculations, both in an examination and in the clinical area. Calculation skills can be a source of worry for many, and although the calculations that is needed in the clinical area are not complex, they can be challenging for those who are being distracted or under pressure. It is important for nurses to be able to use numbers with confidence, safety, especially when administering drugs. The Dosage Calc, which is the app, helps by breaking down the process of drug calculations. In other words, it asks, what is the dose prescribed? There is a drop-down key that automatically converts to either micrograms, milligrams, grams or kilograms, and then no need to make the decision whether you do multiply or you have to divide when making these calculations. Whether it's a one-off or it can be hourly, and that's again included in the app. Then what is the stock strength? Again, just filling in the appropriate box, and again the dosage can be altered to either micrograms, milligrams, grams and kilograms. And again, it gets away from all the calculations. Then the volume which is in the amp, and it's recorded by mLs, or it can be done by litres. And this again, it minimizes the amount of fuss. It goes through, strategize the actual process of filling in the app. And then by pressing the calculate, the answer is available and there to compare with your own calculations. By using the app, it makes the nurse more proficient and more confident. Practice makes perfect. Be a safe and a confident practitioner.